Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're going to be going over how to improve your recovery time with your patellofemoral pain syndromes by using specificity in your corrective and rehabilitative exercises. Hope you enjoy. So learning specificity for your unique body is essential to any type of corrective or rehab program that's going to help with your pains. In the case of patellofemoral joint syndrome, we have typical stability problems or posture and alignment issues with our pelvis, with our knee, and with our foot. And an integrated relationship exists between all three of those structures. Now, there's also considerations that can happen from our upper body, such as our shoulder complex through our lat muscle or through our serratus and rhomboid muscles from our shoulder blade that can affect hip and knee function as well. But for today, we're just going to focus on these three aspects, the pelvis, the knee, and the foot, and learn the specific corrections for your body so you can help with your exercises, avoid irritating and actually helping to stimulate the correct stability to alleviate your patellofemoral pain syndromes and decrease your overall recovery time from your pain. I invite you to get a full body analysis to learn what your unique issues are. We have one of those at either the Pain Free and Fit or Posture Size websites. You can go through and learn what your unique mechanical abnormalities and posture abnormalities are, and then you can better fit those into the exercises we're going to talk about. But to begin, let's look at our pelvis. Most patellofemoral joint pain is a result of an abnormal external rotation on that leg. So because you have a postural tendency to, let's say, cross that leg over the other, either at the ankle or at the knee, stand or walk with that leg out, over time the fascia or the interconnecting webbing of your leg and hip complex becomes tight in holding you out that way. So when you walk, you'll notice that foot actually flares out more than the other side. As a result, what happens, there's a predictable pattern where the glute becomes weak, the glute medius or hip abductor becomes weak in the minimus, and we get an over-tightening of the tensor fascia lata, the iliotibial band. It pulls on the kneecap, causing it to move outwards or upwards, and that aggravates that patellofemoral syndrome. When the leg is out, as we walk, the knee has more of a tendency to bend inwards, which causes that valgus stress, further causing that kneecap to slide outwards and aggravating the cartilage underneath. And the foot has a tendency to pronate because as you strike the ground with your foot out, the heel has a tendency to roll. So we're going to try to envision all three areas, our pelvis, our knee, and our foot, combining into one corrective tension or alignment pattern to help stimulate the proper stabilizing muscles, help to reduce the stress on the overactive muscles, and bring that kneecap in a more aligned position between the hip, knee, and foot. So let's begin with a concept around the knee itself. The stabilizing muscle for the knee that allows it to slide more to the inside into a correct position so it can track or slide up and down in its groove with the upper thigh bone correctly is the VMO. And if you take one finger and place it on the inside of your kneecap and the other on the outside of your kneecap, as you straighten your knee, you'll feel, if you have a typical patellofemoral problem, there'll be more tension on the outside of the kneecap. The knee will actually move towards your outer finger, the actual cap. So to wake up or to create more stability so there's equal muscular force from inner and outer edges, I want you to try to push the entire leg inwards without moving it, just tense it inwards. And as you maintain that tension, as if you're trying to resist your hand pushing the leg out, you'll notice as you straighten your knee, there'll be more tension now towards the inside of the kneecap, and you'll feel that that kneecap won't be pulled so much to the side, but rather more towards the midline, or more tension moving inwards than prior to doing that. Now, we don't want to get used to tensing the entire leg in. There's a lot of rehab programs that use balls in between the legs to squat, do wall squats. That's a mistake because what happens is as the leg comes in, it actually weakens a key stabilizing muscle up at the hip, the glute medius, the glute minimus, the abductor muscles that are usually weak. So just from the beginning, just to understand the tension in with the whole leg is okay, but we want to progress with that over time so that we localize that force just to the kneecap tensing in and not the whole leg. We want to complement that with a proper mechanical correction of the foot. Now, typically, when you have patellofemoral syndrome, that foot wants to roll on its inner edge, on the heel. So we want to put a little more pressure on the outer edge of the heel and complement that by twisting the forefoot of the big ball down. So your foot's actually twisting. The heel is leaning a little more towards the outside into the floor, and the big ball behind the great toe is pushing down. It's a slight twist of the entire foot. There are plenty of joints in the foot that can accommodate that correction. And as you do that, that will also help to wake up that VMO muscle on the inside of your kneecap as you're practicing tensing that leg straight with the previous exercise. So we want to take those two things, kneecap tension in, heel out, and big ball down, and we're going to now put that or stack that with the pelvic correction. Remember I said that that leg likes to turn out usually in a problem of patellofemoral joint pain. So we want to turn it into a comfortable amount, balance our foot just like we learned with a little more pressure on the outer heel, a little bit more on the inner forefoot, and tense the kneecap in as we stand tall. Now from the back, if you're not standing tall, what's typically happening is you have a tendency to hip hike. The hip will come up on the standing side and fall on the unsupported side. So as we maintain those corrections of my kneecap and foot, I want to push my hip down so it becomes level or even a little lower than the other side. That wakes up the stabilizing muscles in my hip. We can progress this by using a split stance position where we have the involved leg forward, and when we have that position, we want to make sure that our foot's far enough forward so that our knee stays well beyond approaching the toe line. If I were to draw a straight line up, I don't want to have that hit. So I want to keep that back. So we're going to keep our heel a little bit more pressure on the outside, big ball of the foot on the inside, tensing the kneecap in, and in this position I want to swing my hip down. Now this is a great starting position to learn to stabilize these muscles in your leg. You're going to use this with exercises such as stationary holds, such as isotonic, moving up and down in either a stationary lunge or split squat, such as step downs, such as step ups, okay? You're going to use this same position if you're squatting on 2 feet, okay? You're going to use the same heel, knee, and hip position. If we're squatting on 2 feet, the tendency for that leg that turns out will be to hip hike. So again, we want to hold that down. So by specifically targeting these 3 areas, the foot, the knee, and the hip, any exercise that you approach with your rehab is going to shorten the overall recovery time. Because the problem with most rehab programs is it's not identifying the typical mistakes that you make as an individual. And as a result, when you then try these exercises, we get all these mechanical mistakes, and it drives the dysfunction harder and harder into your neuromuscular system, and it actually creates more dysfunction patterns, and that takes away from your recovery time. So we have more of these exercises. If you enjoy this, we have a bunch more. You can be subscribing to our channel, and if you like to share this with others, you can help us out by giving us a thumbs up. Any questions or comments, I'll do my best to answer them. Hope you enjoyed this short video to help reduce your recovery time, and hope it helps with your patellofemoral joint pains.